There is a very normal baseline rate of hair shedding in everybody, which is quoted as 100 strands per day. Now you may notice there has been a gradual increase or a sudden increase in hair shedding from your head, and you may see them when you're brushing your hair or after you blow dry your hair and you notice more hair on the floor. Now it is important to note how long that period has been. Has it been a few weeks, a few months, or even maybe a few years? And it's important also to note if the shedding has actually caused a decrease in your hair volume. So what it means when your hair is shedding is that the hair follicle has actually entered a phase of the hair cycle called the Telogen Phase. That's a resting phase where no hair is continuing to grow, but instead what happens is the hair sheds out of your head. They're differentiated into chronicity, which means the duration of how long it's shedding for. Acute telogen effluvium refers to a short-term shedding, and it's usually triggered off by a stressful event. A stressful event could be anything from an illness, a severe illness requiring hospitalization, major surgery, or sometimes an emotional stress such as a bad breakup or a change in living circumstances like moving from country to country. Chronic telogen effluvium refers to shedding heavily for more than 6 months. Some of the factors that may contribute to this include nutritional deficiency. Commonly, we see vitamin D deficiency, B12 or folic acid deficiency, sometimes iron deficiency in this process. Other medical conditions can also mimic chronic telogen effluvium. These include thyroid disorders or anorexia nervosa. Now, this can also be the case that you are just having some aging changes and is associated with middle-aged women. The shedding can be a low grade, 50 to 60 strands a day for a long period, and overall the hair just feels less and less full. How we treat shedding hair really depends on the cause of it. If it is a short-term shedding, acute telogen effluvium, sometimes patience is all that is required. It resolves on its own and hair grows normally at the end of it. It may take 3 to 6 months to see complete resolution of the hair shedding issues. The treatment of chronic telogen effluvium is a little bit different. It usually starts off with a blood test to identify what's going on. Are there any medical conditions that we need to be diagnosing? Are there any nutritional factors that need to be addressed? And that follows by correction of these underlying causes. If you fall into the category where there are no identifiable causes, sometimes we still have to treat you with nutritional supplements, with serums or sprays, or use a treatment we call Terra Scalp Boosters to help your hair grow better. If you'd like to learn a bit more about Terra Scalp Boosters, click here.